A call that is fairly common in pediatric patients is that for a seizure. And just like adults, pediatric patients can have seizures from a wide variety of causes. It could be epilepsy, head injury, low oxygen levels, hypoglycemia, electrolyte disturbances, drug overdose. I think I mentioned head trauma. But anyways, there's several things that can cause seizures. One of them that is unique to children that we don't see in adults is the febrile seizure. And this is when a patient's temperature has come up and they're having a fever. Now, there used to be thought that the higher the fever, the more likely it was to have a seizure with it. And then we thought that maybe the faster the fever went up, the more likely they were to have a seizure. And I don't think the evidence has really supported either of those. We're not entirely sure why some patients have febrile seizures and some don't. I've read that it's around 3 to 5% of children that have fevers may have a febrile seizure with it. Now, regardless of the type of seizure, when we're managing a patient with a seizure, we make sure that they are safe, make sure they're not going to hit themselves on anything. We want to give them oxygen if necessary to maintain their oxygen saturation of 94 to 99%. Check that blood sugar as soon as you can to make sure it's not a hypoglycemia that has caused the seizure, and basically just let them have the seizure. Now, syncopal episodes are something that kind of look like seizures, but a lot of times with a syncopal episode, they might still respond to some like painful stimuli. Typically with a seizure, they may have some incontinence, urinary incontinence, which we don't typically see with syncopal episodes. And with syncopal episodes, my experience is they've just looked a little more limp, or someone having a seizure tends to be a little more actively moving. So a syncopal episode and a seizure can look similar. Regardless, make sure again the oxygen level is good, you've checked their blood sugar, you've protected them so they're not hitting their head, they're in a safe spot where they have their seizure, and don't put anything in their mouth. Now, if the seizure lasts for more than 5 minutes, or if they have seizures back to back, we call that status epilepticus, and that is a true life-threatening condition, and they need to be taken to the emergency department as quickly as possible. So that's a little bit about seizures with children. It is something that we encounter fairly commonly. If it is a febrile seizure, note their temperature. You can cool them off a little bit, or at least take off any excess blankets and coats and things that the parents may have put on them, and find out what time the parents had given any sort of medication for that, like children's Tylenol, acetaminophen, ibuprofen, something like that. And then take them to the hospital, try to figure out why they have the infection.